hypoglossal nerve is the 12th cranial nerve. You know it very well. Then hypoglossal nerve is said to be like, the pure motor nerve. Means it innervates the skeletal muscles of the tongue. And the name hypoglossal, like, hypoglossal means which runs below the tongue. But of course, as I told you before also, that every motor nerve also carries proprioceptive sensations from the muscles it innervates. So it also has afferent fibers running within this nerve. So there are two functional components associated with hypoglossal nerve. One, is general somatic efferent to innervate the muscles derived from the occipital somites, and those are the muscles of the tongue. But out of the 8 pair of the muscles of the tongue, 1 pair is not supplied by hypoglossal nerve, right? The rest of the muscles, 7 pair, they are all innervated by hypoglossal nerve. And the proprioceptive sensations from the same muscles are also carried by the same nerve. Okay. Now, about the hypoglossal nucleus, where it is situated. Here you're seeing is a sagittal section of a brain stem. This is the midbrain, pons, medulla. The blue color nuclei are nuclei of the motor nerves or the motor nuclei. The red ones are the sensory nuclei, and the green one is the nucleus we're talking about. And this is the hypoglossal nerve nucleus, the motor nucleus. And remember about the functional columns. This functional column, general somatic efferent, it is most medially placed in the brain stem and even in the spinal cord. So in this functional column, general somatic efferent from the midbrain region, it was firstly at the level of superior colliculus, the third nucleus. Then at the level of inferior colliculus, there was fourth nerve nucleus. Then it was this sixth nerve nucleus. Remember, in the pons, lower pons, where this facial nerve was winding around, making facial colliculus. So obtuse nerve nucleus is in the same vertical alignment, and then now down below in the medulla, it is an elongated nucleus, cylindrical nucleus, nearly around 2 centimeters in length and extending both in the open and closed portion of the medulla. Got it? And if you trace it vertically down, then you'll find it is in the same functional column where the medial group of nuclei in the anterior horn of the spinal cord are placed. They are also general somatic efferents. Okay, and can you see this location of this hypoglossal nerve nucleus? It is so deeply placed in the medulla that it forms an impression here on the floor of the fourth ventricle. So if you see the floor of the fourth ventricle, you'll find a triangular area representing the bulging because of this nucleus, and that's called hypoglossal trigone in the floor of the fourth ventricle. And similarly, look at this purple color nucleus. Remember, there's a name which describes its location, and that is why this nucleus is called dorsal nucleus. Dorsal nucleus, or the posterior nucleus of vagus, right? So this nucleus is, dorsal nucleus of vagus is general visceral efferent, giving out parasympathetic fibers. And this nucleus even more posteriorly placed. So that's why it's called posterior or dorsal nucleus of vagus. And let's just to tell you that this nucleus also leaves an impression there on the floor of the fourth ventricle, on the dorsum of the medulla. So there you will find in the floor of the fourth ventricle there is a prominence called vagal triangle, vagal trigone. So there will be two impressions in the floor of the fourth ventricle because trigone and hypoglossal trigone. Okay, another impression will be for this and in the upper portion of the floor of the fourth ventricle, and that will be because of the facial colliculus. And can you see this nucleus here, right? Lateral most nucleus, the vestibular and cochlear nucleus. Basically, it's vestibular nucleus here. This also, gives an impression on the floor of the fourth ventricle, the vestibular area, vestibular nucleus images, right? So these are the few nucleus which are just below the floor of the fourth ventricle. This you will find when you will be taught about the fourth ventricle. So all these nucleus, they have impression on the floor of the fourth ventricle, facial colliculus, vestibular area, then vagal triangle and hypoglossal. Okay. So from here, hypoglossal nerve nucleus, general somatic heat print nerve fibers will pass out. Okay. There you find this is the dorsum of the brainstem. Just to tell you what I just explained here, when you see the brainstem from the dorsal view, and this area here is exposed, this is covered by cerebellum. So this has been removed, cerebellum. So you find is the floor of the fourth ventricle, right? So in the floor of the fourth ventricle, you are seeing this impression of facial colliculus. I just told you, and I told you there was this impression of vestibular area, vestibular nuclei placed just below this. And can you see here the hypoglossal trigone, this area, it is medial most nucleus, right? So this triangular area is hypoglossal triangle, and just below to this you will find is the hypoglossal nucleus. And can you see that there is this triangular area, the vagal trigone, right? Because just below this you will find the dorsal nucleus of vagus. Okay. So now we've got to know about the function and components of the hypoglossal nerve. We've discussed about the nucleus, its location in the brainstem. Now we are going to talk about the fibers reaching and passing out from the hypoglossal nerve nucleus. Right? Location-wise, you've got to know it's a cylindrical nucleus located in the medulla, dorsal aspect, 2 centimeter elongated nucleus extending from both the open and closed portion of the medulla. Now about the upper motor neurons. The very important portion of this nerve is only this diagram. You should know that important thing about it is, before to this, let me talk about the topic that I discussed yesterday, so it will help you remembering this. Yesterday while I was teaching you accessory nerve, remember? So accessory nerve, it has two components. Cranial, it contributes with the vagus and supplies the muscles derived from the fourth and sixth arches. Now spinal accessory, right? So spinal accessory, it supplies two muscles connecting the mastoid and trapezius. The important thing there was that in the spinal nucleus of accessory nerve, upper motor neurons innervate sternocleidomastoid. They reach the ipsilateral nucleus, while the upper motor neurons destined to innervate trapezius, they descend to reach the opposite or contralateral nucleus of spinal accessory nerve. However, the lower motor neurons, they supply ipsilateral side. So if it's an upper motor neuron lesion, in case of spinal accessory nerve, there will be contralateral loss of innervation to trapezius and ipsilateral loss of innervation to sternocleidomastoid. So similar such thing was, remember, happening in facial nerve also. Facial nerve, what was happening, that the upper motor neuron fibers to the upper part of the face, they were having a bilateral representation. They were reaching both fibers from the cerebral motor cortex designed to innervate the lower half of the face, they reach only the ipsilateral side, ipsilateral nucleus of facial nerve. So that was discussed in detail about upper motor neuron lesions of facial nerve and lower motor neuron lesions of facial nerve. Now, similar thing, like remember these three nerves you have to remember in case of learning about the special points of having different innervation, different type of innervation in the muscles. So upper motor neuron, especially if you learn about facial nerve, spinal accessory nerve, and now the hypoglossal nerve. So look here now, as I told you before that the precentral gyrus, precentral gyrus is primary motor area number 4, and that has a somatotropic representation of the body parts. And importance is that the parts of the body which has more precise innervation of the muscles, they have a bigger representation on this motor homunculus. So tongue has a big, tongue has all sorts of movements possible. So there's a big representation on the cerebral cortex. The important thing is, look here, these fibers for the hypoglossal nerve nucleus from the cerebral cortex, they descend down and reach both to the ipsilateral and contralateral nucleus of the hypoglossal nerve from both the sides, right? So the upper motor neurons to the muscles of the tongue, they descend down and they reach the hypoglossal nerve nucleus of both the sides, right? While the special thing about Genioglossus is that the fibers destined to innervate Genioglossus muscle from the cerebral cortex, motor cortex, they descend down only contralaterally. They descend down to reach the opposite hypoglossal nerve nucleus only. So that is the important point to remember here about hypoglossal nerve. Okay. Now look here about the lower motor neurons. So from this hypoglossal nerve nucleus, now the fibers they emerge out there we call lower motor neurons, and to all the 7 pair of muscles of the tongue, they will supply ipsilaterally. Clear? And these lower motor neurons, you can see they descend down, and they now we're talking about is the course of the intraneural course of the nerve, right? So first of all, look here, this diagram, can you see, appreciate this, then again you'll find that this fourth ventricle is exposed from the dorsal side, it is open, so it means that it must be a section from the upper medulla. If it would then be closed, then it would have been the area of section of lower medulla, but it's open, so it's the section of upper medulla. So can you see the impression here on the floor of the fourth ventricle? These bulgings, these are forming the hypoglossal trigone on the floor of the fourth ventricle. Okay. Now these will be the pyramids, the anterior bulgings. Anterolateral bulgings are because of the inferior library nucleus, so these are called olives, right? And in between the two, it is this anterolateral sulcus, right? And from the anterolateral sulcus in the brainstem, this was this nerve, hypoglossal nerve, that was emerging out. And down below, if you trace this in the spinal cord, it will be the ventral roots of the spinal nerve, bringing out the somatic efferent fibers. Then they dorsolaterally, you find these bulgings are because of the inferior cerebellar peduncles, right? So in between inferior cerebellar peduncle and olives, this portion here, it's the posterolateral sulcus, and from here in the medulla, it will be 9th, 10th, and 11th cranial nerves will emerge out. And if you trace this sulcus down in the spinal cord, you will find that at this sulcus, posterior sulcus, there will be the dorsal roots of the spinal nerves attached, and that was providing the afferent nerve fibers to enter the spinal cord. Got it? Okay, that was about the diagram. Now the intraneural course of this nerve. You've seen, I told you, hypoglossal nerve nucleus is 2 centimeter long, cylindrical, and then these fibers pass like this. They, pass ventrally and slightly laterally to emerge between the pyramids and polyps in the anterior sulcus. And then within the brainstem, they will cross laterally to these structures. First of all, you'll find is medial longitudinal bundle. Then you'll find this tectospinal tract, right? For the vasoprotective reflex, I told you before. And medial longitudinal bundle, remember, for the synchronized coordinated movements of the eyeballs. And then you have this medial lemniscus. This is the sending pathway for the proprioceptive sensations. Then you have pyramidal tracts and arcuate nucleus, right? So that forms bulging here because the pyramids is called bulging here, the pyramids. So all these structures, you find that these are placed medially, or the nerve runs laterally to all these structures, the midline structures, medial structures. The nerve runs lateral, runs medial to the structures lying lateral to this intraneural course is, first of all, you find is the reticular formation, and I told you this reticular formation you find the entire length of the brainstem, medulla, pons, and midbrain also. So this is placed here. This is the reticular formation and the inferior olivary nucleus, which is placed or which is in lateral relation to the course of the intraneural course of the hypoglossal nerve. Finally, this nerve, when it emerges out here, from the anterolateral sulcus, it will be in two bundles. Important thing is, it will, you will find that this emerges out. Remember yesterday I told you it was emerging out with the help of around 10 to 15 rootlets, right? And out of those 10 to 15 rootlets, they join first of all to form two bundles. So two separate bundles emerge, and then both of them they join, and they pass through this canal, which is placed anterior to the condyles, occipital condyles, and that's called anterior condylar canal or hypoglossal canal, through which this hypoglossal nerve emerges out onto the base of the skull. So this was all about the intraneural course of the nerve and the upper motor neurons. Important point once again is remember that the 5 upper motor neurons to genioglossus descend to contralateral nucleus only, while the rest of the muscles, the fibers, upper motor neurons will reach to both the nucleus. Okay. Now look here, intraneural and intracranial course link. Then intraneural course is important here. You can say here that this I have already taught you, and this portion here is the length of the hypoglossal nerve nucleus. I told you they were arising by around 10 to 15 rootlets from the anterolateral sulcus between the pyramids and olives, and the two of them they were running behind this vertebral arteries. So the vertebral artery, this portion is here. This is the foramen magnum, and the two vertebral arteries goes ascending here, right? So vertebral arteries will ascend anterior to these rootlets of the hypoglossal nerve. So the nerve rootlets, when we're talking about intracranial course, right? Intraneural was this portion, intracranial course. So they will run behind the vertebral arteries, and then in bathing through the subarachnoid space, these rootlets will join to form two nerve roots, right? And remember, important is that the two nerve roots, they pierce the dura mater separately, and they emerge out of this anterior condylar canal as hypoglossal nerve. course will be upward, laterally towards this foramen, and through this foramen there will be its recurrent branch, from the hypoglossal nerve. Meningeal branch will ascend back here into the posterior cranial fossa. This all is, situated within the posterior cranial fossa. So the first nerve from hypoglossal nerve is the meningeal branch, which will wind back and re-enter into the posterior cranial fossa through the anterior condylar canal, and that will be conveying the sympathetic and sensory fibers. But those fibers into this meningeal branch will not be from hypoglossal, rather from the C1, C2 segments of the spinal cord, the sensory components, sensory fibers to the meninges or the dura within the posterior cranial fossa. Got it? So this is how the nerve emerges from the anterior condylar canal. Now we will talk about how is this running in the extracranial course, right? So just imagine here this of course, like first of all you have the orientation of this diagram. When you see the arteries are medially placed and the veins are laterally placed in the neck, and vagus in between. So all this is being covered by the common carotid sheath, the carotid sheath, that modification of the cervical fascia. Then this was entering into the carotid canal into the base of the petrous temporal, and behind to that was this jugular foramen, from where this internal jugular and the three cranial nerve 9th and 11th were emerging out. And no doubt just behind to this jugular foramen, or you can say posteromedially, will be the anterior condylar canal, from where this 12th cranial nerve will also descend down. So out of these four nerves, you can remember the only nerve which winds laterally will be, of course, the spinal accessory, because it has to supply the the muscles on the side of the neck, that is sternocleido and trapezius. So that will wind anterior to the internal jugular. The rest of them will have a medial course. So out of them, remember, now we're talking about this, and remember that's why I was telling, there was a question sometime, what are the contents of the carotid sheath. So remember, all these nerves, they will be initially within the carotid sheath. So this 12th nerve, the hypoglossal nerve, initially when it emerges out of the cranium, it is lying behind the internal jugular vein, right? Because this anterior condylar canal is posterior to the jugular foramen, posteromedial. So that initially it is behind internal jugular, then it winds, descends down in between, internal jugular and internal carotid, and will descend down and will wind laterally to medially, crossing vagus anteriorly. So when it descends down into the carotid sheath, it winds anterior to the vagus from lateral to medial, and further then down here when it reaches, and in this portion here, it's deep down to the styloid process. You can see here is the styloid process, and here it will be parotid gland on outside, and there will be a posterior belly of digastric. So all these structures are covering this neurovascular complex from outside. From outside there will be carotid, posterior belly of digastric, styloid apparatus. All this will be covering the upper portion of these contents. So now this nerve will descend. First, the points to remember is, one thing, it's initially it's behind internal jugular, then it crosses anterior to vagus, then when it reaches the low, it's like this, it's an oblique course of the posterior belly of digastric. So when it reaches the lower border of the posterior belly of digastric, it takes a loop course. This is like a loop, right? You can see it's a looped course. So in its looped course, it crosses the two arteries superficially, like internal jugular and external jugular. So it crosses the two arteries superficially, unlike the two other arteries. Remember, the glossopharyngeal and pharyngeal branch of vagus, they were passing in between internal carotid and external carotid, and while superior laryngeal was passing behind both these arteries. So remember the difference between this. They might ask, like, with the labeling thing, tagging it with a diagram to identify the nerves. So you have to have this idea that the two nerves passing between the two arteries is the glossopharyngeal and the pharyngeal branch of vagus passing between the two arteries. Internal superior laryngeal passes behind both these arteries, common and external carotid, while hypoglossal nerve crosses anterior to both the arteries. Then again, because it's like, this posterior digastric, so after crossing this two nerves, it will also cross the first loop of the lingual artery. So lingual artery, I told you, has a tortuous course, so it will cross lingual artery as well. It will cross the loop of the lingual artery and will now go deep again, deep to the posterior digastric. Okay, and after crossing this, now it reaches into the submandibular region. So this one you're seeing is a mastoides of coronal section here. So here you're seeing is the mastoid, this is hyoid, and this is the transverse process of the atlas vertebrae. So these are the muscle superiors, you can see the posterior superior oblique muscle of the occipital region, and this one is rectus capitis lateralis, the prevertebral muscles. These are the structures I have been already telling you. This is internal carotid, this is external carotid, and this is internal jugular, and the nerves descending from jugular foramen are this spinal accessory. Then you have vagus and the superior laryngeal branch of the vagus, and this one is hypoglossal. So this course it is crossed from deep side to the jugular. Now it has come to lie in between these two vessels and will now in between these two vessels, right, between interjugular and internal carotid. The further in its course, it will winding anterior to both these superficial. It will wind like this, it will wind like this, it will loop like this, crossing superficial to both these vessels, right? And one other important thing that you are seeing here is this external carotid. They might ask you anytime, because there are 8 branches arising from external carotid in the neck. It's a very common MCQ that which branch of external carotid artery arises opposite to facial artery. So at the same level where you find in a cross section that the facial artery emerges from the external carotid, at the same level you find is another artery that arises is the occipital artery. Remember that, okay? So these are the two branches at the same transverse level of external carotid. And there might be questions regarding structures deep to the parotid. I have already told you. Remember, within the content of parotid, there are retromandibular vein, external carotid will also be embedded. Then in facial nerve passing through this, there will be deep parotid lymph nodes. So just give a reading about the parotid and its contents. Then yep. So further, it has this, it's winding like this, looping down below the posterior digastric and crossing this lingual artery later on and will reach into the submandibular region. So you can see a better view here. Here the color coding is for yellow one is this hypoglossal nerve we are talking about, and this is Genioglossus, the blue color thing, and the red one is the common external carotid arteries, internal and external carotids, common internal, external. Okay, look, this course, this as I told you has a looped course, right? So passing in, merging out behind the internal jugular, then passing in between internal jugular, internal carotid, then winding internal and external carotids, then crossing the loop of the lingual artery, and this they have removed actually, that is posterior digastric, which was covering this loop here from outside. So after that, now you can see is reaching here in this is Thyrohyoid ligament and the muscle, and passing deeper to that, now it reaches into the submandibular region where it rests over to this muscle this muscle is Hyoglossus. So it rests over Hyoglossus and it supplies the muscles of the tongue, extrinsic muscles and intrinsic muscles. So obviously it's resting on Hyoglossus. It will supply here, it will supply Genioglossus also, and will supply the Styloglossus. Now look here, this one is the Styloglossus. So the 3 extrinsic muscles it is supplying is Hyoglossus, Styloglossus, Genioglossus, and of course the intrinsic muscle. There are 4 pairs: superior longitudinal, inferior longitudinal, transverse, and the vertical fibers. So it will supply them also. Now, what it will be? What will be structures covering it from outside? The superficial structures covering it, like to cover up this section. So from above, it will be covered by the deeper portion of the submandibular salivary gland, and above to that will be the muscle. Remember, the muscle which indents the submandibular salivary gland, which is making it in a J-shaped gland. The muscle was mylohyoid. So that muscle mylohyoid will be lying superficial to the hypoglossal nerve, or you can say this won't be visible if there is this muscle mylohyoid. So this hyoglossus runs in between mylohyoid and hyoglossus, right? Similarly will be this lingual nerve. Don't forget that this lingual nerve is also running there superficial to this hyoglossus, and under the cover of mylohyoid, the two nerves running over hyoglossus, lingual nerve and hypoglossal nerve. While you can see here is glossopharyngeal. Now glossopharyngeal is the nerve which runs deep to the hypoglossus. Their relation step by step. So first of all, when you dissect, you'll find the superficial portion of the submandibular gland, and then the mylohyoid. When you remove the mylohyoid muscle, you will find the two nerves. The hypoglossal, the lingual, resting on the hyoglossus. We remove the hyoglossus, and then you will find is glossopharyngeal. Okay. Remember, glossopharyngeal was the main sensory and general sensory and special sensory nerve supply of the posterior one-third of the tongue. Okay, so this was about the extracranial course. Here you can see in the submandibular region, ventral view, you can see in the stylohyoid muscle, right, coming from the styloid process. This is the hyoid, so this is the hyoglossus muscle, right, and this is genioglossus. You can see the most bulkiest out of the 8 pairs, the bulkiest muscle of the tongue, if they ask, is genioglossus, and the very important muscle, this muscle is for the protrusion of the tongue. So this muscle you can see is genioglossus, right? While geniohyoid, remember, is not from the direct branch of hypoglossal nerve. So only the muscles which have the glossus word as suffix, they will be innervated by hypoglossal nerve. Right? So genioglossus, hyoglossus, styloglossus, not geniohyoid. This will be supplied, but via different nerve fibers on the C1 cervical segment. Anyways, we'll discuss about them later on. So here once again the course. These two nerves, I told you, if a nerve is, if imagine there is no labeling in this diagram and they ask which nerve is this. So with the, diagram, the illustration, you can see that this is crossing the loop of the lingual artery, one thing running over hyoglossus and then supplying the muscles here, right, genioglossus. So this will be hypoglossal nerve. Think about this lingual. I told you the lingual and they are in the same plane. Lingual nerve will cross styloglossus, and important thing is if you find a submandibular ganglion attached or suspended, and that is through the lingual nerve, right? And this lingual nerve, remember, and this duct of submandibular gland, the relation was N for nerve, N for niche. So the nerve crosses the duct from below, right? These are the things, and this is the deeper portion of submandibular gland, right? Deeper portion of submandibular gland, say duct nickel-ray, right? And it was opening here on the papilla below to the frenulum attached to the tongue, right? Sublingual papillae पे open होती है ये submandibular duct. Now all this will be covered by a muscle called mylohyoid, right? And the superficial portion of this submandibular gland will be resting over the surface of mylohyoid. While this nerve, as I said, was running deeper to the hyoglossus, and this nerve is glossopharyngeal nerve. You can see it's going deep inside deep below the hyoglossus muscle. Okay. Now talking about the branches of hypoglossal nerve. So it's like easy, it's the prime motor nerve supply for the tongue. Out of the 8 pairs, 7 pairs are innervated by this muscle, right? So forget about this palatoglossus because that is by vago accessory complex and through the pharyngeal complex. Then look here, the hypoglossal nerve from 10 to 15 root. This is like a summary of hypoglossal nerve, including the branches. So these are the rootlets, 10 to 15 rootlets. They emerge from the anterolateral sulcus of the upper medulla between pyramids and olives. They together emerge behind the vertebral artery. Then the two rootlets, these filaments, the rootlets, they join to form two roots, right? And the two roots, they pierce the dura separately, and then they join and they emerge out through this anterior condylar canal, the hypoglossal canal, and it's initially behind the internal jugular, then between internal jugular and internal carotid, then passing below on superficially related to internal jugular and external carotid, and passing superficial to the first loop of the lingual artery. Here it is all covered by three structures I told you: styloid process, and then posterior valley of the digastric, and parotid gland. Then it reaches in the mandibular region where it crosses this hyoglossus. It rests over the hyoglossus and genioglossus, and similar was this course. Lingual nerve also was lying in this plane, covered by the mylohyoid muscle. So that was the course. Now look here about the the branches, right? So as I told you, the first branch, right, will be a meningeal branch. But again, because it's not a direct branch, so let's divide it into two ways. The branches of the hypoglossal nerve, which carry the fibers from the hypoglossal nerve nucleus. And then we'll talk about the branches of this nerve which are carrying fibers from C1 or C2 segment of the spinal cord. So this has fibers from cervical segments as well. So initially this way of talking is because it's mainly for the tongue. So the fibers from hypoglossal nucleus will only supply the muscles of the tongue. So it comes out here, right? So it starts giving its own branches here to styloglossus, to hyoglossus, to genioglossus, the three extrinsic muscles of the tongue, and of course the four pair of intrinsic muscles of the tongue will also be innervated by the same nerve. And look here, this is lingual nerve, and don't forget that it also will have a communicating branch with the lingual nerve, right? So that was about the pure branches, or the branches from the hypoglossal nerve nucleus. Now we are talking about the fibers of C1 segment. Look here, this is the spinal cord, right? From the spinal cord, these are the branches arising from C1, C2, C3 spinal segments, right? So the branches, the sensory components from C1, or you can simply just remember that the C1 joins the hypoglossal nerve, right? The fibers from C1, the sensory branches from C1 will join hypoglossal nerve, and they will blend into the common epineurium. So the fibers of C1, when they're running within the hypoglossal nerve, they will ascend back and will give a branch called meningeal branch of hypoglossal nerve. It will be called as meningeal branch of hypoglossal nerve, but it has not the fibers from hypoglossal, because it's not a sensory nerve. You know that hypoglossal is pure motor nerve, right? So it has no sensory components, but the sensory fibers within this nerve are from the C1 segment. So that's why this branch, the meningeal branch of hypoglossal nerve, will ascend back into the hypoglossal canal and will supply the dura in the anterior portion of the posterior cranial fossa, and it will supply not only the sensory fibers but also the sympathetic fibers, right? So that is the meningeal branch. Then the another branch from this C1 component, along with the hypoglossal, is the descendens hypoglossi, or the upper root of Ansa cervicalis, right? This descends down like here. Then this loop, it supplies the suprahyoid muscles, right, and infrahyoid muscles. I'll tell you the muscles innervated. You can see here. We'll discuss later on. Look here, these fibers, now C1, along with the hypoglossal nerve, will convey and will supply the two suprahyoid muscles, and these are geniohyoid, right? It's a glossus word used neither here, right? So it's a geniohyoid and thyrohyoid. So remember that the hypoglossal nerve, through its C1 components, give three branches. One is meningeal branch, The other is the descending loop of Ansa cervicalis, descending loop of descendens hypoglossi, or the upper root of Ansa cervicalis, and the two muscular branches to thyrohyoid and geniohyoid. Okay. Okay, so this is called the superior root of Ansa cervicalis, which is also called descendens hypoglossi, and then this is Ansa means a curve or a bend, right? Curve rather. Bend is different word, that's called Geno. This is Ansa. Ansa is a loop, and then this is the inferior root of Ansa cervicalis, and this inferior root of Ansa cervicalis is formed by the merging of C2, C3 nerve fibers. Remember, okay. So this root will also have motor fibers, right? Here it was giving sensory fibers only to meningeal, but this will all have motor efferent nerve fibers also, because they will innervate the infrahyoid muscles as well. Okay. So just a fast revision. I think tongue must have been taught to you. So these are the Genioglossus, Hyoglossus, Styloglossus, intrinsic muscles, palatoglossus. All the muscles here, these are the extrinsic muscles. Intrinsic muscles itself are 4 pairs, right? So fast innervation of these muscles. Remember, hypoglossal nerve, direct branches, right? Hypoglossal nerve from the hypoglossal nerve nucleus will supply Genioglossus, Hyoglossus, Styloglossus, and intrinsic muscles, right? So palatoglossus, I have told you, you can include a better word here. It's vago-accessory complex, right? Cranial accessory, vagus through the pharyngeal plexus. That is the supply for palatoglossus, and this might also supply few fibers to styloglossus as well. Then functions of these muscles, I think just fast read kar lete hain because they're already given here. The posterior fibers of Genioglossus, they push the tongue root forwards and protrude the tongue. Remember, the more important function is protrusion of the tongue outwards, and that's why it is called the life-saving muscle, because if this paralyzes, tongue sets back and it closes the gullet. Okay, so this is a life-saving muscle. And anterior fibers, they'll depress and retract the tongue. And while the this one is Hyoglossus. Hyoglossus is coming from below, right, from the hyoid. So it will retract the tongue and will depress the sides of the tongue, right? And you can say, you can like curving the muscle, right? The margins on the two sides, depressing the margins. Then styloglossus obviously is coming from behind the styloid process, so it will draw the tongue upwards. It will elevate the posterior portion of the tongue upwards, right? It will withdraw the tongue back. Then intrinsic muscles के अलग अलग हैं. Alters in the tongue shape can cause tongue to shorten, narrow, and curve. Remember, if we're talking about superior longitudinal muscles, like this can be asked in different form of questions. Which muscle causes the curling of the tip of the tongue upwards? Answer is superior longitudinal muscle. Which muscle causes the curving of the tip of the tongue below? The answer will be inferior longitudinal muscles, right? Which muscle causes flattening of the tongue? Flattening of the tongue, remember. So the answer will be vertical muscles, vertical fibers. And which muscle causes the cylindrical shape of the tongue, right? Which muscle causes cylindrical shape of the tongue? The answer will be transverse fibers, right? So those are about the altering in shape of the tongue. And palatoglossus, of course, from the palates is coming down into the tongue, so it will elevate the back portion of the tongue. It will help you touch your dorsum of the tongue to the hard palate. So this was a summary from your book. You can see here, this is the hypoglossal nerve. This is the first C1. Through this, it is giving this meningeal branch, sensory and sympathetic fibers to the dura inside the posterior fossa, and this will also give this descendens hypoglossi and will supply thyrohyoid and the geniohyoid muscle, right? And through this loop, you can see is this upper root. Through this root, it will supply this muscle sternohyoid, right? Sternohyoid will supply kari. Then it will also supply the upper belly of omohyoid. While through this, Ansa cervicalis, it will supply the inferior belly of omohyoid, and the, this ascending loop, this will be formed by C2 and C3. Okay, you can have a better nerve within a common epineurium, right? So there will be, I told you, there will be a communication, of course. Through these communications, the fibers will enter into this nerve as well. And this is the meningeal branch. This is the descendants hypoglossite. These are the branches to thyroid and geniohyoid. This will supply by C1 component, thyroid and geniohyoid. While through this descendants hypoglossite will supply the superior belly of armohyoid and the sternothyroid, and through this loop Ansa cervicalis it will supply sternothyroid and the inferior belly of armohyoid. Okay, so it's done.